Today's topic that we're talking about is critical thinking in the field of sonography. When we talk about critical thinking is the ability to analyze information effectively to form a conclusion. Critical thinking allows for you to strengthen your ability to identify credibility and self-awareness.
Critical thinking is very important in general, and it's also very important in my field of interest. Critical thinking is a domain general thinking skill, meaning no matter what path or profession you pursue, these skills will always be relevant and beneficial to your success. Also, critical thinking is, like I said, very important in my field of interest, which happens to be sonography. And, you have to be able to interpret images effectively, make informed decisions, handle complex cases, and just so much more. When discussing critical thinking, a big concept happens to be analysis. It just plays a very big role in critical thinking. You have to be able to analyze and evaluate information to form well-reasoned judgments and conclusions. For example, evaluating sources, exploring pros and cons, questioning and challenging ideas, as well as comparing and contrasting ideas.
When discussing critical thinking, we often discuss the concept of effective communication. Effective communication is clear, concise, prepared exchange of ideas and emotions. This is a key skill in many fields. Problem solving in critical thinking is the act of defining a problem, identifying what could be a cause of this problem, and then identifying solutions or what could result of the problem that you have identified.
As far as academic interest and professional applications, Carolina and I's professional interest or academic interest is medical sonography, which can also be known as an ultrasound tech or a sonographer.
Daily tasks and challenges that a sonographer is faced with include high-stress environments, rapid changes, and need for continuing education, as well as challenges with technology. An example of daily challenges professionals are faced with include, but are not limited to, ectopic pregnancies, in which a sonographer is faced with a timely measure that can be taken of what they can do for the patient, as well as when they are presented with mass, cyst, or abscess, what is the further imaging that can be taken, as well as including prior history that the patient has to what could be affecting them.
One concept that is connected to the profession of medical sonography is analysis. Analysis is used a lot when it comes to medical sonography. You have to be able to analyze images and interpret them. You also have to be able to diagnose your patient via analyzing images and testing, ruling out all probable cause before giving a true diagnosis. Some real-world examples are analyzing an abdominal ultrasound to visualize abdominal tissues and organs, or a fetal ultrasound to view the fetus in pregnancy.
Effective communication is also a key skill in the career field of sonography. This is a key skill because sonographers should obtain effective communication throughout their whole career. This takes part when you are dealing with co-workers, physicians, patients. It allows for you to diffuse and lessen confusion or miscommunications while you are working. If there's a patient that has an abnormality, it allows for you to effectively communicate what that is that the patient is experiencing and what it is that you are seeing in a way that doesn't worry the patient, but also allows for them to understand what it is you are presenting them. When discussing problem solving in the career field of sonography, it is a crucial concept that a sonographer should understand well. When a patient whose symptoms are not textbook and present abnormalities, this is when you are to identify the problem, adjust your techniques and angles to allow for the best possible diagnosis of your patient, as well as discussing with physicians and other co-workers for feedback